everybody. Welcome to today's chat. I'm Gail, and I'm part of the Understood team. Today we're going to be talking about ADHD and emotions, and we are joined by Dr. Tom Brown, who is Understood's consulting psychologist and an ADHD expert. Hi, Tom. How are you?
Hi, Gail. I'm doing well. How about you?
Terrific. Before we jump in, do you want to introduce yourself a little bit to everybody?
Sure. I'm a clinical psychologist. I did my initial training at Yale and then was invited to join the clinical faculty there. And so for 25 years, I was helping to teach in the Department of Psychiatry at Yale Medical School while running a private clinic specializing in ADHD with children, teenagers, and adults. And then about 4 years ago, after my wife died, I moved out to the West Coast because I had 2 grown kids and 2 grandkids out here. And I've now relocated myself and opened my clinic in Manhattan Beach, California, and do some teaching at University of Southern California's medical school, and am enjoying it.
That sounds like a terrific move.
Yeah, I don't have to scrape ice off my windshield in the morning when I go to work during the winter.
I was going to say, you should have been here this morning.
Yeah, I understand there was quite a bit of snow coming.
Yeah, there was a good load today. Tom, before we jump in, I just want to remind everybody that if you have questions for Tom, just write them in the box. We'll try to get to as many as we possibly can. Okay, so Tom, quickly, can you just sort of describe what type of issues kids have with managing emotions and why kids with ADHD would be struggling with that?
Sure. The first thing to say is that the irony is that the current diagnostic criteria for ADHD say nothing about managing emotions. And yet those of us who do research and treat patients with ADHD and parents and teachers who are familiar with kids who have ADHD know very well that that's a big part of the difficulties that many of these children and adolescents and even some adults with ADHD struggle with. And the question that comes up often is, well, what's so different about somebody with ADHD in terms of emotions compared to somebody who doesn't have ADHD? And the short answer is that the same problems that interfere with a person who has ADHD being able to get themselves organized as they're getting ready to go off to school or to work in the morning, or in being able to prioritize their tasks, or being able to sort of get their ideas together to write a book report. Those same problems of difficulty with organization and difficulty with being able to move big picture, small picture, macro view, micro view, those things all operate on the way each person deals with emotions too. So it's not like people with ADD have any different. I use ADD and ADHD interchangeably, but it's not like these folks have any different emotions. It's that they're likely to experience their emotions with more intensity and have a little more difficulty in managing them.
What can parents do in the moment if they have a kid who is really struggling to sort of pull it together? What can parents do to help?
And the most important thing is don't throw gas on the fire. Often what happens is when you've got a kid shooting his or her mouth off and being, and acting really annoyed and often provocative, if the parent gets engaged with them and starts confronting them and arguing back, what you're going to do is prolong the argument and jack up the intensity of it. I think what you want to do is to try to tell them, I'll be glad to talk with you when you calm down. Why don't you go do something else for a while and then we'll talk later, because what's happening is you're getting annoyed and I'm getting annoyed, and let's try and settle it when both of us can keep our cool.
Okay, so almost like don't try to nip it in the middle of the storm. Wait until it's a calmer time.
Well, yeah, if you could do that. Now, sometimes they'll follow you around and hassle with you. The better thing is to try and get it before it becomes an issue. before voices are raised and obscenities start getting thrown around, it usually works better if there's some concern that the kid is presenting that something is missing or something didn't get done the way they thought, or somebody else is giving them a hard time. The first thing to do is try and hear what they're saying, and let them know that you'd be glad to try and work that out. But once it gets to the point where it's starting to escalate, you want to be sure you don't escalate along with them. Mm-hmm. You want to try and keep your cool insofar as you can do that. Now, none of us can always do that when we're dealing with somebody else who's being really confrontational. But insofar as you can, if you can, try and chill it out and try and get the kid to back off and talk about it when everybody's settled down a little more.
Is there some sort of shorthand you can work out with your child so that the child at least can recognize what's happening to them in the moment? Like,
a lot of families that I've talked with have learned that if they get a signal, and one way of doing it is just something like this, which is a sign for timeout. And you let the kid and the parent make an agreement that if either one of them calls for a timeout, that both people will try to stop talking at that point and give it at least 5 or 10 minutes for people to settle down so that you can then be a little more calm in trying to deal with whatever the actual issue is.
Terrific. I have a question here from a parent who wants to know if there's a way to differentiate sort of emotional outbursts due to ADHD versus those that are due to Asperger's, nonverbal learning disabilities. Is there a distinction between the two?
Well, anger is usually, pretty similar regardless of who it's coming from. There are some people who, it's more cold anger. They just stop talking to you or just make snotty comments. And then there's a hot anger, which is sort of screaming at the top of one's lungs to be able to make a point. And I think the difference between ADHD and Asperger's, for example, is that with Asperger's, sometimes it's hard to follow what set it off. Or it may come with a little more intensity, and the problem is it sometimes is displaced. That you may end up hearing about something where the anger is coming now, but the event occurred 2 days ago. It's not always so easy to track what the issue is. And that's assuming that we're dealing with somebody with Asperger's who can be articulate about it. And then he can. Mm-hmm. Not all.
And would the strategy for managing in the moment be the same?
Yeah, I think so. The main thing, you want to get across two things. One is, we're not going to be able to really sort this out right now because you're screaming at me and I'm annoyed with you for screaming at me, and I want both of us to be able to calm down, but I will work this out with you after we've had a chance to chill out a little bit. I think it's you don't want to come across as though you're just saying, shut up, I don't want to hear anything about this now or ever.
Right.
It's like I'm willing to try and hear what you're talking about. I can't promise you I'm going to give you what you want, but I'll certainly be glad to try and figure out if there's a way we can solve this that'll work for both of us.
What about handling this kind of situation with an adolescent? We have a parent who would like to be able to let their adolescent sort of blow off some steam and feel like, being at home with the parent is a safe place to do that. So where can you draw the line between that and letting it go on and, not somehow putting the brakes on it eventually?
Well, what I think the main thing is you don't want either person to lose control. And I'm talking about lose control of themselves. And the one line that I think is really important to maintain is you don't let people put their hands on other people in anger. And that's a rule which I think is good to stick to from very early on. in terms of, for example, when a kid is pushing or kicking at a parent, that's behavior you do not want to let go on, because the problem is it can really escalate, and then people can get in the habit of doing that, and people can get hurt. So I think no hands-on in anger. And most parents would also want to maintain a rule that says we're going to, I don't want to listen to your talking to me if you're going to be really disrespectful.
Mm-hmm.
If you're going to start using swears in talking to me, that's going to be the end of the conversation until you can chill out enough to be able to talk in a respectful way. I will respect you. I want you to respect me. Mm-hmm. Those are sort of ground rule kinds of things that ought to be set up at a time when everybody's calm and implemented when they're not calm.
And does that get sort of accompanied by, listen, I want to, help you work through this, or I'm here to, to hear about what's upsetting you?
But at which time you're likely to get from the kid, well, you always say that and you never do it. Mm-hmm. So I think that it's certainly important to get across the idea of, I want to talk this out with you. I want to understand better what it is that's getting you so angry right now. But I'm not going to do it with your screaming at me. And I don't want to be screaming at you. Mm-hmm. So let's talk about it. The thing is, if you say that, you've got to follow through. Because otherwise it's, correctly perceived as just a dismissal of the issue. And as though you really don't give a damn about whatever it is that they're so upset about at the moment.
Got it.
But I think the other thing that's important is to let this be reciprocal. That if you've got a parent who's unloading on a kid and things are beginning to escalate, they should be able to call for a timeout too. Mm-hmm. Because sometimes we end up shooting our mouths off in ways that later we wish we hadn't.
Right. So it's kind of like modeling self-control and management.
And then I think the other thing that needs to be said about this is, we can talk all we want about how to do these things in a reasonable way, but the fact is any one of us as parents and any kid is going to have times where they lose it. And the best thing you can do in a situation like that is, try to extricate yourself from the situation, to calm down, and then to apologize for whatever point where you feel like you've gone over the line. And that's a kind of modeling of saying, hey, look, I was really annoyed. I had a phone call 5 minutes before we started this conversation with somebody that really was annoying me, and you're bringing up this thing at the same time, and you didn't deserve everything I said to you. Sorry about that.
Right. We have a parent with a question that I think must be a fairly common one, about kids who are super sensitive and then feel super awful when they've, had an outburst or said something, nasty. So then you have a kid who feels terrible. So how do you handle that sort of dichotomy?
Well, when you've got a kid who's overdoing it in terms of feeling guilty about something, I think if they feel like they've got some reason to feel guilty, you give them something to do, like, okay, well, look, you really were kind of snotty in what you said, and I don't like the way you were talking to me. I'll tell you what, I'll make you a deal. You can do this or that chore for me and show me, a couple of hours of good behavior, and then we'll be at peace. So that there's it's a kind of doing your penance. But the other thing is, if it's something where they're really being absurd about it, that can become a gimmick that some kids use to just soften the impact of whatever guilt. And then you're supposed to say, oh, don't worry about it, it's nothing. And often parents then get a little saccharine in the way that they go to it. So, in some ways the kid may deserve to feel bad about what he or she has done. Mm-hmm. Or if it seems like they're making too big a deal about it, simply say that, I didn't like what you did. It's over now, and let's be done with it. I don't see why it seems like such a huge deal to you.
Right.
Is there something else I don't know?
Right. You know, I'm looking at the questions we're getting, and there's a couple of them, both from parents and from teachers, about how to work together to manage, emotional outbursts or difficulty with self-calming in the classroom.
Yeah, that's a tough spot to do it because the problem is, of course, you've got a big audience going on, and you've also got other things that need to be taken care of. So I think a useful thing is to have an established policy that if somebody is beginning to get too irritable or disrespectful or so forth, you can use the 1, 2, 3 thing, which is simply to say, it's like Tom Phelan's strategy 1, 2, 3 magic. It's you tell them once, and just tell them, look, if somebody being disrespectful or something like that, I'll give one warning, and then you go change your seat and go to the back of the room or go outside in the hall if whatever the school's setup is. And then if that's not the case, then you're going to have to go outside and go to the office of the guidance counselor or the principal, whoever's going to be around. But the idea of it is if you get everybody, and the other thing you want to say to the rest of the kids is, if somebody is misbehaving, you do not become the audience. You do your work.
Mm-hmm.
Because otherwise you can get kids cheering the other kid on or acting like they're all the teachers and adding their own commentary, either orally or finger shaking or so forth. But I think that, to recognize that all of us can get upset sometimes with good reason, sometimes with not such good reason. Mm-hmm. And that we need to have a certain amount of willingness to, if somebody does lose it, to acknowledge that they're upset and maybe, if they be coherent about it, let them say what it is they're concerned about, but then it's got to be cut off and can't go on and on. Mm-hmm. And usually that means getting the person who's having so much difficulty out of the room.
Mm-hmm. Tom, what about kids who, rather than getting angry, get upset? So, you end up with tears and it's sort of just the inability to get that under control. How do you help the, upset, sad child?
Well, in the same way, if you don't want it to grow, don't fertilize it. If a kid is making a big deal about something by being very tearful, often you can't even tell what it's about, and then they're crying and you can't very well explain it. What you can say is, look, I see you're upset, and I'm willing to talk with you, and you can calm down and start talking in a reasonable way. Or I'll be able to talk with you during recess.
Mm-hmm. And at home, when it's...
At home, if you get that sort of thing and say, look, I deal with it pretty much the same way that you deal with angry outbursts. That if it, and I think you have to use your own intuitive sense of sometimes the kid is really in pain. That their sense of shame and guilt over what they're saying is way out of proportion. And maybe they really have done something that warrants they're being upset. And in that case, I think one would just want to reach out to them and hold them. Mm-hmm. And speak reassuring to them about, what you did was wrong and hurtful, but I love you. And we'll get this worked out, and we'll talk some more about it when you're calmed down.
Okay, so it sounds like, again, that the key is to tell them and honor it yourself that we're going to handle this when we can both be calm.
Yeah, but if you've got a kid who's really tearful and upset, you can give them a hug. But the problem is if you make that a standard policy, that there come some kids who have this strategy where they'll be disrespectful and rude, and then realize they're into deep water here, mm-hmm. and then start crying, and then use that as a way of trying to cancel everything out.
Right.
And sometimes what you need to do is say, okay, I'm going to give you this hug, and you know I still love you, but you're going to do without your video games for the next 24 hours because of it.
Right. We have a couple parents who would like to touch a little bit on the topic of medication and managing emotions. Sort of, is it effective? How to gauge the effectiveness? Medication versus behavioral therapy for managing emotions. Can you sort of give a little bit of info on how those things interplay?
Sure. If a child has ADHD and that's been diagnosed in a way that you trust, then for 8 out of 10 people, medication helps. And it helps not only with being able to focus and improve ability to do schoolwork and impulsive behavior and so forth, but often, not always, but often it helps with emotional control as well during the time the medicine's active. But it's important to understand that when we say 8 out of 10 people benefit from medication with ADHD benefit from medication, for some it's huge how much it helps them. For others it's substantial but not huge. Others it helps a little but not that much. And 2 out of 10 it doesn't do a damn thing. That's talking about the 2 types of medicine that we most often use and are the most adequately researched. But the fact is that there's some kids whose emotional difficulties are really problematic for them, that they tend to fly off the handle, and sometimes it's hard to tell how much of anger is fear. Because there are some kids who, when they get scared about something, and are really scared about something, that they tend to act angry. And if that's an ongoing problem, it's probably a good idea to talk with a specialist, a pediatrician or some other psychologist or psychiatrist, if you can, to try and get a sense of whether there's a bigger problem here than just regular old ADHD. Right. And in some cases, we will use either change the dosing or timing of the ADHD medication or possibly add something else. But you want to look at it carefully to be sure of what it is you're dealing with. Now, for example, if you've got a family where there's some people with bipolar disorder, really have short fuses and get angry very easily, and your kid is having similar problems, that's likely to be a little more complicated. Sometimes ADHD medicines can jack up anxiety or make people more irritable. And so that's something important to check. Now, one thing that some prescribers don't know is the amount of medicine you need for a stimulant is not determined by how old you are, how much you weigh, or how severe the symptoms are. It's how sensitive is your body to it. And there are some very little kids, most of them are going to be taking small doses if they're taking it at all, who have ADHD, that don't respond to the usual small doses. And you've got to take the dose up closer to the adult dosing range in order to be able to do it, because their bodies are just not that sensitive to it, even though for other kids of the same age and size, it'd be way too much. And on the other end of it, there are some people we see in our clinic, adults who have ADHD, who are taller and fatter than I am, who you give a dose that's effective, and it's no different than what you give somebody who's 5 years old. It's not about how old you are, how much you weigh, or how severe the symptoms are. It's how sensitive your body to it.
Mm-hmm. Hey, Tom, can you talk a little bit about the stuck piece of kids having trouble with emotion? So, the kid that just cannot let go of something that's happened, something that's upsetting. How do parents sort of get in there and get things moving beyond that upsetness?
Well, there's no trick that always works. I think that the first thing you want to do is to try to respond to the kid in a way that makes clear what your understanding is of what the problem seems to be. So you're telling me that today at recess, the teacher made you stand out and you felt it was really not fair because somebody else was doing what the teacher thought you were doing. Is that right? Is there something I don't understand about it? Okay, and then you give them a chance to explain what the problem is and to be heard. And then there's a certain point where you just say, for example, one of the things we have to teach our kids is the world is not always fair. Mm-hmm. And that sometimes people get blamed for stuff they didn't do, or sometimes adults are just in a crabby mood and they'll take it out on somebody who happens to be there. And it becomes a way of educating them about a simple fact that all of us have to learn to live with. And sometimes you may also need to remind them that they I'm thinking, for example, about a kid who was going to go on strike with the teacher and put his head down and not do any work for day after day after day until the teacher started treating him the way he felt he should be treated. Mm-hmm. And the message to that kid was, look, I've got news for you. The grown-ups are running the world, not the children. We don't always do things right, and but the fact, we sometimes do not do a very good job of running it, but we're running it. And if the teacher's the one who is making that decision, unless it's something that's really pretty gross, we're just going to have to let it go.
Right. What can you say, or rather, is it okay to say to your child at some point, listen, I'm always happy to hear and talk, but, it's too much, or it's gone on for too long. How do you say that to your child while still, inviting conversation?
Well, you can say, look, we've been talking about this now for way too long, and unless there's something new that you have to say that I haven't heard that you think I should know, I want you to stop talking about it. Mm-hmm.
So very direct.
If you feel like you've got to say more about it, go get a piece of paper and sit down and write out whatever it is you want me to know. But you've got to stop talking about it, because I'll tell you right now, I'm getting annoyed with the way you're keeping on and on and on. I've got other things I'm interested in, other things I need to do, and you need to be able to suck it up. You can't expect that I or anybody else is going to constantly listen to your complaints over and over and over when it's the same damn thing. Mm-hmm.
Mm-hmm. Tom, what about the issue of sort of the family tone when you have a kid who struggles a lot with handling emotions? So, for instance, if you've got the younger kid who's losing it all the time, what do you do with the older siblings or the younger ones who are in an environment where this is a constant?
I think that you want to take a look at the whole family picture and maybe get some help to sort it out if it's becoming something that's that persistent. And the main thing is the same thing as what I was talking about in the classroom. You want to minimize the impact of the audience. And just say, look, when Joey starts having one of his fits, stay out of it. Don't let yourself get in to try and talk him down unless I ask you to. And don't be trying to be his lawyer with me. We need to work this out. And I understand that it's really frustrating to you like it is to me to have this take up a lot of time. And if you do the things that I'm asking you to do and don't make things worse, I'll have something nice for you later. So there's a payoff for staying out of the fray.
And what can you say to your ADHD child? Is it okay to say, look, when this happens, it's upsetting for your siblings? Or do you also leave that out of the equation?
No, I would. At which point, if you're telling them that when they're angry, they're going to say, I don't care. You give them, you're unfair to me, and give them all the good stuff anyhow. And that's just getting into the argument further than you want to. Mm-hmm. I think what you can do is say, look, this is not something that's good for you, for me, or for anybody else in this family to have this happening so loud, so long, and so frustrating. Mm-hmm. We need to figure out a better way to do it. And some families will do something as simple as saying, all right, if you got a complaint, write it down, write a few words that will remind us what it's about, and we've got a little box on top of the refrigerator or over on that side table. Anybody who's got a gripe, throw it in there, and then once a week at a particular time, we'll open the box and see if we need to do anything together to figure out how to do this. So that it's like a complaint file. And often when that gets done, 2 days later, everybody's forgotten what it is. As long as you've got a time when you really do deal with it, because if that's just a matter of like another wastebasket, nobody's going to take it seriously.
That's terrific advice. Guys, we're out of time, unfortunately. Thank you, Tom, so much for joining us.
Well, thank you, Gail. It's always good to talk with you, and I'm grateful for all the people who've tuned in. Thanks very much.
And for everybody out there, if you have more questions, you can visit the community and ask them there at u.org/community. And if you want to see portions of this or any of the other chats, you can find them at u.org/calendar. Sorry about that. So have a great day, and we'll see you next time. Bye-bye.